Everyone, and welcome to today's Explainer. Look, let's just jump right in, because today we're tackling a topic that touches honestly so many of our lives, and yet it's usually completely surrounded by this dense cloud of anxiety. We are going to explore some absolutely incredible, truly groundbreaking recent advancements in breast cancer treatment. If you, or maybe someone you love, has ever faced a diagnosis, you know that immediate, gut-wrenching fear that sets in. But my goal today is to walk you through the actual data and the latest medical realities. We're going to see exactly how modern medicine is shifting that whole narrative away from fear and pointing it straight toward hope. So listen to this number, because it's kind of startling. 1 in 9. In Japan, estimates show that 1 in 9 women will be affected by breast cancer in their lifetime. It's become a really common illness. And when we hear our friend or family member gets that diagnosis, it is totally natural to be terrified. Our minds immediately go to the worst-case scenarios, right? Like, is the treatment going to be incredibly painful? Will it bankrupt us? Are they going to survive? Those are incredibly valid fears, mostly because that's how things used to be. But as you're about to see, the medical field has literally revolutionized the answers to all of those questions.
To really get a clear picture of this revolution, here is our quick roadmap for this explainer. We'll start with the current state of treatment, break down the cancer types and stages, and then look at the evolution of surgery and radiation. From there, we'll dive into gentler drug therapies, personalized medicine, and finally, how AI is stepping into healthcare.
All right, kicking things off with Section 1, the current state of breast cancer treatment and how we are shifting the paradigm. Moving right along to Section 2, cancer types and stages, or really, just understanding the rules of the game here. Okay, so to understand how doctors customize these treatments, we really have to grasp one fundamental thing. Breast cancer is not just one single illness. It actually has different biological natures and progresses in completely different ways. And that is exactly why modern treatments absolutely have to vary from person to person. It's basically divided into 3 main types. First, you've got the hormone-positive type. This one is fueled by female hormones like estrogen or progesterone, so naturally, hormone therapy is highly effective here. Second is the HER2 positive type, which just means there's an excess of a specific protein called HER2. For this, doctors use targeted drugs like Herceptin to attack that protein directly. And finally, there's the triple negative type. This one lacks both hormone receptors and those HER2 proteins. Since the usual targets aren't there to hit, doctors usually rely on standard chemotherapy or, increasingly, really advanced immunotherapy. Basically, the biological nature of the cancer literally dictates the unique medical weapon they use against it.
Now, that biological nature also dictates the game plan across the different stages of the disease, which range from 0 to 4. Stage 0 is non-invasive. The tumor is just localized to a tiny, tiny area. And if you catch it here, surgery often results in a complete cure, which is amazing. Stages 1 through 3 mean the cancer is starting to spread locally, maybe into the lymph nodes. Surgery is still the standard go-to here, but it's usually teamed up with radiation or chemo. Then we get to stage 4, which is metastatic. This means the cancer has spread to other organs, like the lungs, liver, or brain. At this point, complete surgical removal usually isn't on the table, so the focus shifts entirely over to systemic drugs and radiation.
Which brings us to Section 3, the evolution of surgery and radiation, focusing on those physical treatments.
For literally decades, just the thought of breast cancer treatment brought up these terrifying, deep-seated fears of having to lose a breast completely or suffering through agonizing radiation burns. But I'm here to tell you, the reality has drastically changed. Back in the day, a total mastectomy, which is removing the entire breast, was pretty much the standard. But today, breast-conserving surgery is actually the norm. That means doctors only remove the bad portion and leave the rest of the breast totally intact. In fact, over 70% of early-stage patients now choose this option. And the mental health benefits of this are just immense. Being able to preserve the breast means patients can maintain their body image, confidently go to public baths, wear swimsuits, and just go about their daily lives with so much less emotional distress. It's a real game changer.
And what about if you need radiation after that surgery, just to make sure it doesn't come back? Well, traditionally, radiation was this grueling, awful process lasting 5 to 6 weeks, and it often caused really severe, painful burns and extreme fatigue. But today, thanks to incredibly high-precision radiation therapy, doctors can focus the beam strictly on the cancer while completely protecting the healthy tissue around it. Treatments that used to take weeks now often just take about 3 weeks. And get this, in some absolutely incredible cases, the whole thing can be completed in just a single dose. No way, right? The physical burden on the body is just astonishingly low compared to the past.
Let's look at Section 4, gentler drug therapies, and how science is rewriting the script here. There's this super common, widely held fear that chemo automatically equals unbearable suffering. We all know those horror stories of severe nausea and just totally wiping people out. But modern medicine has essentially ripped up that old script and replaced it with far gentler alternatives. Let's break down these modern drug categories really quickly. First up, hormone therapy. Like we talked about, this suppresses cancer growth by blocking hormones. The side effects? Mostly just mild menopause-like symptoms, maybe some hot flashes or joint pain, rather than that really severe nausea. Next is molecular targeted therapy. You can think of these as brilliant little sniper drugs. For instance, that drug Herceptin we mentioned, it binds only to the HER2 receptors on cancer cells, basically pinpointing and destroying them while completely sparing all your healthy cells. That drastically reduces side effects. Finally, immunotherapy. This is absolutely fascinating. It actually takes your own immune cells, supercharges them, and puts them right back into your body to fight the cancer naturally. Now, it can be pretty expensive and is often a last resort since it isn't fully covered by standard insurance yet, but for the people it works on, it can be miraculously effective.
Moving to Section 5, personalized medicine, or what's sometimes called order-made treatment.
Here's the thing. Doctors are no longer just looking at a tumor's size or what it looks like under a microscope. They are literally reading its genetic code. This is personalized medicine, customizing treatment based entirely on an individual patient's unique genetic information. Doctors now use something called a panel test to read the actual design blueprint of the cancer cells. They are hunting for exact genetic mutations, and if they find a specific mutation and there happens to be a drug designed to target that exact mutation, they match them up perfectly. It's like finding the perfect puzzle piece. It is a highly precise, totally individualized approach. And honestly, what's truly wonderful here is that while this whole process used to be prohibitively expensive just a few years ago, it is now increasingly being covered by health insurance under certain conditions.
Finally, Section 6, AI in healthcare. The future of medicine is quite literally right now. Guys, we aren't talking about science fiction anymore. Artificial intelligence is actively working alongside human doctors in hospitals today. Just look at how it's being used. AI systems are doing precision image and pathology diagnostics, meaning they analyze cellular abnormalities with just mind-blowing accuracy. Plus, AI acts as this massive decision support system. By crunching incredibly vast amounts of genetic data and scanning through a patient's entire medical history, AI systems, like the ones developed by IBM, can actually suggest the most effective personalized treatment plans. But crucially, they act as a safety net. They catch those tiny needle-in-a-haystack details that even the best human specialists might miss, essentially preventing human error.
I think this quote from Dr. Yoichi completely hits the nail on the head regarding the medical frontline. He says it's best to separate what humans can do and what AI can do and have them cooperate successfully. You see, the absolute cutting edge of medicine isn't just a human endeavor anymore. It's this incredibly powerful, highly efficient collaboration. AI brings the relentless data crunching and flawless precision, while human doctors bring the empathy, the communication, and that vital final clinical judgment.
Which leaves us with this pretty profound question to ponder. How will humans and AI continue to collaborate to fight disease in the future? As we've seen today, breast cancer treatment has evolved from a place of immense physical and mental burden into this brilliant era of highly targeted, personalized, and AI-supported care. If you or someone you know is facing this, you should absolutely feel empowered by this new, hopeful reality. Armed with this knowledge, you can go in and confidently consult your medical team about the best, most personalized options available to you right now. Thank you so much for hanging out with me for this explainer. Keep learning, keep asking those big questions, and stay curious.